people living there. On the 21st October 2021, it was reported that the country had surpassed 1 billion vaccinations. So we look at techniques such as disinfection taking place around the world. In Tehran, for example, metro lines to prevent COVID-19 transmission. Similar measures have been taken in other countries. So disinfection was very common. If we remember, Iran reported its first confirmed cases on the 19th February 2020 in Qom. Early measures included the cancellation, closure of concerts and other cultural events, Friday prayers, and school and university campuses. So there was a lot of problem, actually. There was a lot of stress and distress, and people really suffered, and the economy was impacted. Iran became a center for the pandemic in February 2020. More than 10 countries traced their outbreaks to Iran by the 28th of February, indicating a more severe outbreak than the 388 reported cases. The Iranian parliament closed after the 23rd of its 290 members tested positive. 23 of its members are tested positive for COVID-19 on the 3rd of March 2020. And at least 12 sitting or former Iranian politicians and government officials died by the 17th of March in 2020. And there are probably a few MPs died in Europe and America and maybe Britain, but I don't remember important people dying in this country, because I think probably because of advancement of health management and equipment available in these countries. By August 2021, the pandemic's fifth wave peaked with more than 400 deaths in a day. COVID-19 was confirmed in South Korea on the 20th January 2020. Military bases were quarantined after tests showed 3 infected soldiers. South Korea introduced what was then considered the world's largest and best organized screening program, isolating infected people and tracing and quarantining contacts. The screening method included mandatory self-reporting by new international arrivals through mobile application, combined with drive-through testing and increasing testing capabilities to 20,000 people a day. Despite some early criticism, South Korea's program was considered a success in controlling the outbreak without quarantining entire cities. In Europe, as we look at the impact of COVID-19 pandemic, we look at the death per 100,000 residents. The COVID-19 pandemic arrived in Europe with its first confirmed case in Bordeaux, France, on the 24th January 2020, and subsequently spread widely across the continent. By the 17th March 2020, every country in Europe had confirmed a case, and all had reported at least one death, with the exception of the Vatican City. Italy was the first European nation to experience a major outbreak in early 2020, becoming the first country worldwide to introduce national lockdown. By the 13th March 2020, the World Health Organization declared Europe the epicenter of the pandemic, and it remained so until the World Health Organization announced it had been overtaken by South America on the 22nd of May. By the 18th of March 2020, more than 250 million people were in lockdown in Europe. Despite deployment of COVID-19 vaccines, Europe became the pandemic's epicenter once again in late 2021. The Italian outbreak began on the 31st of January 2020 when two Chinese tourists tested positive for SARS-CoV-2 in Rome. Cases began to rise sharply, which prompted the government to suspend flights to and from China and declared a state of emergency. On the 22nd February 2022, the Council of Ministers announced a new decree law to contain the outbreak, which quarantined more than 50 people in northern Italy. On the 4th March, the Italian government ordered schools and universities to close down in Italy as Italy reached 100 deaths. Short sport was suspended completely for at least 1 month. On the 11th of March, Italian Prime Minister Giuseppe Conte closed down nearly all commercial activity except supermarkets and pharmacies. On the 19th of April, the first wave of ebbed as seventh-day death declined to 433. On the 31st of October, the Italian government again issued restrictive rules to contain the second wave. On the 10th of November, Italy surpassed 1 million confirmed infections. On the 23rd November, it was reported that the second wave of the virus led some hospitals to stop accepting patients. Vaccination at a retirement home in Gorjan, Spain, in December 2020. The virus first confirmed to have spread to Spain on the 31st, 2020, when a German tourist tested positive for SARS-CoV-2 on La Gomera in the Canary Islands. Post-hoc genetic analysis has shown that at least 15 strains of the virus had been imported, and the community transmission began by mid-February. On the 29th of March, it was announced that beginning the following day, all non-essential workers were ordered to remain at home for the next 14 days. The number of cases increased again in July in a number of cities, including Barcelona, Zaragoza, and Madrid, which led to imposition of some restrictions but no national lockdown. By September 2021, Spain was one of the countries with the highest percentage of its population vaccinated, 76% fully vaccinated and 79% with the first dose. Italy is ranked second at 75%. Sweden differed from most European countries in that it mostly remained open. Per the Swedish constitution, the Public Health Agency of Sweden has autonomy that prevents political interference, and the agencies favored remaining open. The Swedish strategy focused on longer-term measures based on the assumption that after lockdown, the virus would resume spreading with the same results. By the end of June, Sweden no longer had excess mortality. The evolution in the United Kingdom meant that each of its four countries developed its own response. England's restrictions were shorter lived than the others. The UK government started enforcing social distancing and quarantine measures on the 18th of March 2020. On the 16th, Prime Minister Boris Johnson advised against non-essential travel and social contact, praising work from home and avoiding venues such as pubs, restaurants, and theaters. On the 28th of March, the government ordered all leisure establishments to close and promised to prevent unemployment. On the 23rd, Johnson banned gatherings and restricted non-essential travel and other activities. Unlike previous measures, these restrictions were enforceable by police through fines and dispersal of gatherings. Most non-essential businesses were ordered to close on the 24th April 2020. It was reported that a promising vaccine trial had begun in England. The government pledged more than £50,000 million toward research. On the 16th of April 2020, it was reported that the UK would have first access to the Oxford vaccine due to a prior contract. Should the trial be successful, some 30 million doses would be available. On the 2nd of December 2020, the UK became the first developed countries to approve the Pfizer vaccine. 800,000 doses were immediately available for use. In August 2022, it was reported that viral infection cases had declined in the UK. North American experience of the COVID-19 pandemic. The virus arrived in the United States on the 13th January 2022. Cases were reported in all North American countries after St. Kitts and Nevis confirmed a case on the 25th of March, and in all North American territories after Bonaire confirmed a case on the 16th of April. Per hour world in data, 103,436,829 confirmed cases have been reported in the United States, with 1,127,153 deaths, the most of any country, and the 19th highest per capita worldwide. COVID-19 is the deadliest pandemic in U.S. history. It was the third leading cause of death in the U.S. in 2020, behind heart diseases and cancer. From 2019 to 2020, U.S. life expectancy dropped by 3 years for Hispanic Americans, 2.9 years for African Americans, and 1.2 years for white Americans. These effects have persisted as U.S. deaths due to COVID-19 in 2021 exceeded those in 2020. In the United States, COVID-19 vaccines became available under emergency use in December 2020, beginning the national vaccination program. The first COVID-19 vaccine was officially approved by the Food and Drug Administration on the 23rd of 2021. By the 18th November 2022, while cases in the United States had declined, COVID variants BQ1.1 had become dominant in the country. In March 2020, all cases of community transmission were confirmed across Canada. All of its provinces and territories declared states of emergency. Provinces and territories, to varying degrees, implemented school and daycare closures, prohibitions on gatherings, closures of non-essential businesses, and restriction on entry. Canada severely restricted its border access, barring travelers from all countries with some exceptions. Cases surged across Canada, notably in the provinces of British Columbia, Alberta, Quebec, and Ontario, with the formation of the Atlantic bubble, a travel restricted area of the country formed of the four Atlantic provinces. Vaccine passports were adopted in all provinces and two of the territories. Per a report on 11th November 2020, Canadian health authorities saw a surge in influenza, while COVID-19 was expected to rise during winter. In South Africa, the dealing with a COVID-19 pandemic, using disinfection of public area in Itapevi, Brazil. In South America, COVID-19 pandemic was confirmed to have reached South America on the 26th of February 2020, when Brazil confirmed a case in Sao Paulo. By the 3rd April, all countries and territories in South America had recorded at least one case. On the 13th May 2020, it was reported that Latin America and the Caribbean had reported over 400 cases of COVID-19 infection, with 23,091 deaths. On the 22nd May 2020, citing the rapid increase of infections in Brazil, the World Health Organization, WHO, declared South America the epicenter of the pandemic. As of the 16th of July 2021, South America had recorded 34,359,631 confirmed cases and 1,046,229 deaths from COVID-19. Due to shortage of testing and medical facilities, it is believed that the outbreak is far larger than the official number show. The virus was confirmed to have spread to Brazil on the 25th of February 2020, when a man from Sao Paulo who had traveled to Italy tested positive for the virus. The disease had spread to every federative unit of Brazil by the 21st of March. On the 19th June 2020, the country reported its 1 million case and nearly 49,000 reported deaths. One estimate of underreporting was 22.62% of total reported COVID-19 mortality in 2021. As of the 8th of July 2023, Brazil, with 37,671,420 confirmed cases and 703,196 deaths, and the third highest number of confirmed cases and the second highest death toll from COVID-19 in the world, behind only those of the United States and India. In Africa, the incidence of COVID-19 pandemic in Africa, the U.S. Air Force personnel unloaded a C-17 aircraft carrying medical supplies in Niger in April 2020. The COVID-19 pandemic was confirmed to have spread to Africa on the 14th of February in 2020, with the first confirmed case announced in Egypt. The first confirmed case in sub-Saharan Africa was announced in Nigeria at the end of February of 2020. Within 3 months, the virus had spread throughout the continent, as Lesotho, the last African sovereign state to have remained free of the virus, reported a case on the 13th of May 2020. By the 26th of May, it appeared that most African countries were experiencing community transmission, although testing capacity was limited. Most of the identified imported cases arrived from Europe and the United States rather than from China, where the virus originated. Many preventive measures were implemented by different countries in Africa, including travel restriction, flight cancellations, and events cancellations. Despite fears, Africa reported lower death rates than other more economically developed regions. In early June 2021, Africa faced a third wave of COVID infection, with cases rising in 14 countries. By the 4th of July, the continent recorded more than 250,000 new COVID cases, a 20% increase from the prior week and a 12% increase from the January peak. More than 16 African countries, including Malawi and Senegal, recorded an uptick of new cases. The World Health Organization labeled it Africa's worst pandemic week ever. In October 2022, World Health Organization reported that most countries on the African continent will miss the goal of 70% vaccination by the end of 2020. Oceania, the experience of the Oceanians trying to deal with COVID-19 pandemic, there were scenes of empty shelves at the Coles grocery store in Brisbane, Australia in April 2020. The COVID-19 pandemic was confirmed to have reached Oceania on the 25th January 2020, with the first confirmed case reported in Melbourne, Australia. It has since spread elsewhere in the region. Australia and New Zealand were praised for their handling of the pandemic in comparison to other Western nations, with New Zealand and each state in Australia wiping out all community transmission of the virus several times, even after reintroduction into the community. As a result of the high transmissibility of the Delta variant, however, by August the 21st, the Australian states of New South Wales and Victoria had conceded defeat in their eradication efforts. In early October 2021, New Zealand also abandoned its elimination strategy. In November and December, the following vaccination efforts, the remaining states of Australia, excluding Western Australia, voluntarily gave up COVID-0 to open up state and international borders. The open borders allowed the Omicron variant of COVID-19 to enter quickly, and cases subsequently exceeded 120 a day by early March 2022. With cases exceeding 1,000 a day, Western Australia conceded defeat in its eradication strategy and open its borders despite record cases. Australian jurisdiction slowly removes restrictions such as close contact isolation, mask wearing, and density limits by April 2022. On the 9th September 2022, restriction was significantly relaxed. The aircraft mask mandate was scrapped nationwide, and daily reporting transition to weekly reporting. On the 14th of December, COVID-19 disaster payment for isolating persons was extended for mandatory isolation. By the 22nd of September, all states amended mask mandates on public transport, including Victoria, where the mandate had lasted some 800 days. On the 30th of September 2022, all Australian leaders declared the emergency response finished and announced the end of isolation requirements. These changes were due in part to high levels of hybrid immunity and very low case numbers. We're looking at Antarctica and their experience while dealing with COVID-19 pandemic due to its remoteness and sparse population. Antarctica was the last continent to have confirmed cases of COVID-19. The first cases were reported in December 2020, almost a year after the first cases of COVID-19 were detected in China. At least 36 were infected in the first outbreak in 2020, with several other outbreaks taking place in 2021 and 2022. We look at the United Nations jurisdictions and their responding to COVID-19 2019, the United Nations Conference on Trade and Development, UNSC, was criticized for its slow response, especially regarding the UN's global ceasefire, which aimed to open up humanitarian access to conflict zones. The United Nations Security Council was criticized due to the inadequate manner in which it dealt with the COVID-19 pandemic, namely the poor ability to create international collaboration during this crisis. On the 23rd of March 2020, United Nations Security Secretary General Antonio Manuel de Oliveira Guterres appealed for a global ceasefire. 172 UN member states and observers signed a non-binding supporting statement in June, and the United Secretary Security Council passed a resolution supporting it in July. On the 29th of September 2020, Guterres urged the International Monetary Fund to help certain countries via debt relief, and also call for countries to increase contribution to develop vaccines. World Health Organization's response to COVID-19 pandemic. How they deal with it in countries, including having joint meetings with Tehran city administrators as examples of their commitments trying to deal with COVID-19. The World Health Organization spearheaded initiatives such as the COVID-19 Solidarity Response Fund to raise money for the pandemic response, the United Nations COVID-19 Supply Chain Task Force, and the Solidarity Trial for investigating potential treatment options for the disease. The COVAX program, co-led by the World Health Organization Gavi and the Coalition for the European Preparedness Innovation CEPI, aim to accelerate the development, manufacture, and the distribution of COVID-19 vaccine and the guarantee fair and equitable access across the world. Look at some restrictions across the globe involving the pandemic, COVID-19, looking at medical supply situation in countries like the Philippines. The pandemic shook the world's economy with especially severe economic damage in the United States, Europe, and Latin America. This is precisely part of the reason why I'm trying to deal with COVID-19 in the context of the cost of living in Britain and across the globe. A consensus report by American intelligence agencies in April 2021 concluded efforts to contain and manage the virus have reinforced nationalist trends globally as some states turned inward to protect their citizens and sometimes cast blame on marginalized groups. COVID-19 inflamed partisanship and polarization around the world as bitter arguments exploded over how to respond. International trade was disrupted amid the information of no entry enclaves. Looking at travel restrictions across the globe with reference to the COVID-19 pandemic, the pandemic led many countries and regions to impose quarantines, entry bans, and other restrictions either for citizens, recent travelers to affected areas, or for all travelers. The travel collapse worldwide, damaging the travel sector. The effectiveness of travel restriction was questioned as the virus spread across the world. One study found that travel restriction only modestly affected the initial spread unless combined with other infection prevention and control measures. Researchers concluded that travel restrictions are most useful in the early and late phase of an epidemic, and restriction of travel from Wuhan unfortunately came too late. The European Union rejected the idea of suspending the Schengen free travel zone. This is a dynamical effect of COVID-19 economically, socially, culturally, interpolitically, and in various ways, which is all the more for the reason for me to discuss COVID-19 with reference to the cost of living as a global crisis. Repatriation of foreign citizens, and these are part of the impact of COVID-19. Looking at Ukraine, evacuating Ukrainian citizens from Wuhan, China. Several countries repatriated their citizens and diplomatic staff from Wuhan and surrounding areas, primarily through charter flights. Canada, the United States, Japan, India, Sri Lanka, Australia, France, Argentina, Germany, and Thailand were among the first to do so. Brazil and New Zealand evacuated their own nationals and others. On the 4th of March, South Africa repatriated 112 South Africans who tested negative, while 4 showed symptoms were left behind. Pakistan declined to evacuate its citizens. On the 15th of February, the United States of America announced it would evacuate Americans abroad aboard the Diamond Princess cruise ship, and on the 21st February, Canada evacuated 129 Canadians from the ship. In early March, the Indian government began repatriating its citizens from Iran. On the 20th of March, the United States began to withdraw some troops from Iraq. The impact of COVID-19 across the globe, the social impact of pandemic, economic impact of the COVID-19 around the world, the impact on aviation, science, technology, on financial markets, and the 2020 stock market crash and COVID-19 recession. So this is quite relevant in our discussing the cost of living as being created in a primary sense by COVID-19. A stock index chart shows the 2020 stock market crash. The pandemic and recession and responses to it damaged the global economy. On the 27th February 2020, worries about the outbreak crashed U.S. stock indexes, which posed their sharpest fall since 2008. Tourism collapsed due to travel restriction, closing of public places including travel attractions, and advice of governments against travel. Airlines cancelled flights while British regional airline flight collapsed. The cruise line industry was hard hit, and train stations and ferry ports closed. International mail stopped or was delayed. The rail sector faced reduction in store hours or closures. Retailers in Europe and Latin America faced traffic declines of 40%. North America and Middle East retailers saw a 50% to 60% drop. Shopping centers faced a 33 to 43% drop in foot traffic in March compared to February. Mall operators around the world cope by increasing sanitation, installing thermal scanners to check the temperature of shoppers, and cancelling events. Hundreds of millions of jobs were lost, including more than 40 million jobs in the US. According to a report by Yelp, about 60% of US businesses that close will stay shut permanently. The International Labour Organization ILO reported that the income generated in the first 9 months of 2020 from work across the world dropped by 10.7% or 3.5 trillion. We look at supply shortages as we look at the impact of COVID-19 pandemic. COVID-19 fears led to panic buying of essentials across the world, including toilet paper, instant noodles, bread, rice, vegetables, infectants, and rubbing alcohol. Picture taken in February 2020. Pandemic fears led to panic buying, empty grocery of essentials such as food, toilet papers, and bottled water. Public buying stemmed from perceived threat, perceived scarcity, fear of unknown, coping behavior, and social psychological factors, examples social influence and trust. Supply shortages were due to disruption to factory and logistics operations. Shortages were worsened by supply chain disruptions from factory and port shutdowns and labor shortages. Shortages continued as managers underestimated the speed of economic recovery after the initial economic crash. The technology industry in particular warned of delays from from underestimates of semiconductor demand for vehicles and other products. According to World Health Organization Secretary General Tedros Ghebreyesus, demand for personal protective equipment (PPE) rose 100-fold, pushing prices up 20-fold. PPE stocks were exhausted everywhere. In September 2021, the World Bank reported that food prices remained generally stable and the supply outlook remained positive. However, the poorest countries witnessed a sharp increase in food prices, reaching the highest level since the pandemic began. The agricultural commodity price index stabilized in the third quarter but remained 17% higher than in January 2021. By contrast, petroleum products were in surplus at the beginning of the pandemic as demand for gasoline and other products collapsed due to reduced commuting and other trips. The 2021 global energy crisis was driven by a global surge in demand as the world economy recovered. Energy demand was particularly strong in Asia. Looking at arts and cultural heritage, the impact of the COVID-19 pandemic on the arts and cultural heritage, the performing arts and cultural heritage sectors have been profoundly affected by the pandemic. Both organizations and individuals' operations have been impacted globally. By March 2020, across the world and to varying degrees, museums, libraries, performance venues, and other cultural institutions have been indefinitely closed with their exhibitions, events, and performances cancelled or postponed. A 2021 UNESCO report estimated 10 million jobs losses worldwide in the culture and creative industries. Some services continued through digital platforms such as live streaming concerts on web-based arts festivals. Politics. The impact of COVID-19 on politics, the global pandemic, and international relations. The pandemic affected political systems, causing suspension of legislative activities, isolations or death of politicians, and scheduled elections. Although they developed broad supporting among epidemiologists, NPI non-pharmaceutical interventions were controversial in many countries. Intellectual opposition came primarily from other fields along with heterodox epidemiologists. Brazil. The pandemic and the response of Brazilian politicians to it led to widespread panic, confusion, and pessimism in Brazil. One question regarding record deaths in the country in April 2020, Brazilian President Jair Bolsonaro said, "So what? I'm sorry. What do you want me to do about it?" Bolsonaro disregarded World Health Organization recommended mitigation techniques and instead downplayed the risk of the virus, promoted increased economic activity, spread misinformation about the efficacy of masks, vaccines, and public health measures, and distributed unproven treatments, including hydrochloroquine and ivermectin. A series of federal health ministers resigned who were fired after they refused to implement Bolsonaro's policies. Disagreements between federal and state governments led to a chaotic and delayed response to the rapid spread of the virus, exacerbated by pre-existing social and economic disparities in the country. Employment, investment, and evaluation of the Brazilian real plummeted to record lows. Brazil was also heavily affected by the Delta and Omicron variants. At the height of the outbreak in the spring of 2021, 3,000 plus Brazilians were dying per day. Bolsonaro's loss of Lula da Silva in the 2022 presidential election is widely credited to the former mishandling of the pandemic. China and the United States relations with reference to COVID-19. Multiple provincial level administrators of the Chinese Communist Party (CCP) were dismissed over their handling of the quarantine measures. Some commentators claim this move was intended to protect CCP General Secretary Xi Jinping. The U.S. intelligence community claimed that China internationally underreported its COVID-19 caseload. The Chinese government maintained that it acted swiftly and transparently. Journalists and activists in China who reported on the pandemic were detained by the authorities, including Zhang Zhan, who was arrested and tortured. Looking at Italy, Palazzo Margherita lit an Italian flag to show solidarity under COVID-19 pandemic 26th of March 2020. In early March 2020, the Italian government criticized the EU's lack of solidarity with Italy. On the 22nd of March 2020, after a phone call with Italian Prime Minister Giuseppe Conte, Russian President Vladimir Putin ordered the Russian army to send military medics, disinfection vehicles, and other medical equipment to Italy. In early April, Norway and EU states like Romania and Austria started to offer help by sending medical personnel and disinfection, and European Commission President Ursula von der Leyen offered an official apology to the country. The United States of America and the anti-lockdown protests rallying at Ohio State House on the 20th of April 2020, population change by county during the COVID-19 pandemic, July 2020 and July 2022. Beginning in mid-April 2020, protesters objected to the government-imposed business closures and restriction on personal movement and assembly. Simultaneously, essential workers protested unsafe conditions and low wages by participating in the brief general strike. Some political analysts claim that the pandemic contributed to President Donald Trump's 2020 defeat. The outbreak promoted calls for the United States to adopt social policies common in other wealthy countries, including universal health care, universal child care, paid sick leave, and higher levels of funding for public health. The Kaiser Family Foundation estimated that preventable hospitalization of vaccinated Americans in the second half of the 2021 cost the US 13.8 billion. There were also protests in regards to vaccine mandates in the United States. In January 2022, the U.S. Supreme Court struck down an OSHA rule that mandated vaccination or testing regime for all companies with greater than 100 employees. So look at other countries. The number of journalists in prison or detained increased worldwide. Some detentions were related to the pandemic. The planned NATO Defender 2020 military exercise in Germany, Poland, and the Baltic Sea, the largest nation war exercise since the end of the Cold War, was held on a reduced scale. The Iranian government was heavily affected by the virus, which infected some 24 parliament members and political figures. Iran President Hassan Rouhani wrote a public letter to world leaders asking for help on the 14th March 2020 due to a lack of access to international markets. Saudi Arabia, which had launched a military intervention in Yemen in March 2015, declared a ceasefire. Diplomatic relations between Japan and South Korea worsened. South Korea criticized Japan's ambiguous, and perceived quarantine efforts after Japan announced travelers from South Korea must quarantine for 2 weeks. South Korea society was initially polarized on President Moon Jae-in's response to the crisis. Many Koreans signed petitions calling for Moon's impeachment or praising his response. Some countries passed emergency legislation. Some commentators expressed concern that it could allow governments to strengthen their grip on power. In Hungary, the parliament voted to allow Prime Minister Viktor Orban to rule by decree indefinitely, suspend parliament and elections, and punish those deemed to have spread false information. In countries such as Egypt, Turkey, and Thailand, opposition activists and government critics were arrested and allegedly spreading fake news. In India, journalists criticizing the government's response were arrested or issued warnings by police and authorities. Food systems, with reference to the cost of living, with the COVID-19 pandemic, we talk about food security finally, which are the feature of cost of living. The pandemic disrupted food systems worldwide, eating at a time when hunger and undernourishment were rising. An estimated 690 million people lack food security in 2019. Food access fell, driven by falling incomes, lost remittances, and disruption to food production. In some cases, food prices rose. The pandemic and its accompanying lockdowns and travel restrictions showed movement of food aid. According to the World Health Organization, 811 million people were undernourished in 2020, likely related to the fallout of COVID-19. Education, as impacted by COVID-19 pandemic, students taking end-of-year exams in places like Tabriz, Iran during the pandemic. The pandemic impacted educational system in many countries. Many governments temporarily closed their educational institutions, often replaced by online education. Other countries, such as Sweden, kept their schools open. As of September 2020, approximately 1.077 billion learners were affected due to school closures. School closures impacted students, teachers, and families with far-reaching economic and societal consequences. They shed light on social and economic issues, including student debt, digital learning, food insecurity, and homelessness, as well as access to childcare, healthcare, housing, internet, and disability services. The impact was more severe for disadvantaged children. The Higher Education Policy Institute reported that around 63% of students claim worsened mental health as a result of the pandemic. Just some of the evidence to kind of like back up some of the things I said at the opening of this video. The impact of the pandemic cannot be underestimating on employment, education, health, and all these actually factors affecting the cost of living. Some people cannot work now because of depression, mental health, mental illness, physical disabilities, and also lack of motivation, family crisis. So many issues now is impacting on families, family lives, and including family breakdowns and all sorts of problems happening due to COVID-19 on health, the impact of such, and issues of mental health during the COVID-19 pandemic, as we shall see with these pieces of information. And the pandemic impacted global health for many conditions. Hospital visits fell. Visits for heart attack symptoms declined by 38% in the United States of America and 40% in Spain. The head of cardiology at the University of Arizona said, "My worry is some of these people are dying at home because they are too scared to go to the hospital." Just like I said, and this carries on to the present moment impact of COVID-19 as it continues to impact on society, as it continues to affect the cost of living as a cause. The people with stroke and appendicitis were less likely to seek treatment. Medical supply shortages impacted on many people. The pandemic impacted mental health, increasing anxiety, depression, and post-traumatic stress disorder, affecting healthcare workers, patients, and quarantined individuals. A lot of people lost their loved ones during this period, and they are still suffering from the impact of loss, bereavement, and failure, like I said, failure of the government. All this time, the government had been unable to help anyone. The problem being the public sector has been closed. The government is actually incapacitated, literally. And from now going forward, even the war in Ukraine, whatever other crisis, the cost of living itself is a crisis, the government being unable because of the incapacitated, the failure of the public sector in delivering public services in late 2022 during the first Northern Hemisphere autumn and winter season following the widespread relaxation of global public health measures. North America and Europe experienced a surge in respiratory viruses and co-infections in both adults and children. This formed the beginnings of the 2022-2023 pediatric crisis, and what some experts have termed a triple demic of seasonal influenza, respiratory syncytial virus (RSV), and SARS-CoV-2 throughout North America. In the United Kingdom, pediatric infections also began to spike beyond pre-pandemic levels, albeit with different illnesses such as Group A, streptococcal infection, and the resultant scarlet fever. As of mid-December 2022, 19 children in the United Kingdom had died to strep A, and wave of infection had begun to spread into North America and mainland Europe. Let us look at the environmental impact of COVID-19. Images from the NASA Earth Observatory show a stark drop in pollution in Wuhan when comparing NO2 levels in early 2019 top and early 2020 top. The pandemic and the reaction to it positively affected the environment and climate as a result of reduced human activity during the anthropos fossil fuel use decrease, resources consumption decline, and waste disposal improve, generating less pollution. Planned air travel and vehicle transportation decline. In China, lockdowns and other resources resulted in a 26% decrease in coal consumption and a 50% reduction in nitrogen oxide emissions. A worldwide variety of largely mammalian species, both captive and wild, are being shown to be susceptible to SARS-CoV-2, with some encountering particularly fatal outcomes. In particular, both farm and wild mink have developed symptomatic COVID-19 infections, leading to a 35 to 55% mortality rate in one study. Other animals, such as white-tailed deer, have not exhibited as high mortality numbers, but have effectively become natural reservoirs of the virus, with large numbers of free-ranging deer infected throughout the US and Canada, including approximately 80% of Iowa wild deer herd. Discrimination and prejudice. We look at xenophobia and racism related to the COVID-19 pandemic, and socially distanced homeless encampment in San Francisco, California in May 2020. Heightened prejudice, xenophobia, and racism toward people of Chinese and East Asian descent were documented around the world. Reports from February 2020, when most confirmed cases were confirmed to China, cited racist sentiments about Chinese people deserving the virus. Chinese people and other Asian peoples in the United Kingdom and the United States reported increasing level of abuse and assaults. US President Donald Trump was criticized for referring to SARS-CoV-2 as the Chinese virus and Kung Fu terms, which were condemned as being racist and xenophobic. Age-based discrimination against older adults increased during the pandemic. This was attributed to their perceived vulnerability and subsequent physical and social isolation measures, which, coupled with their reduced social activity, increased dependency on others. Similarly, limited digital literacy left the elderly more vulnerable to isolation, depression, and loneliness. In a correspondence published in the Lancet in 2021, German epidemiologist Gunther Kampf described the harmful effects of inappropriate stigmatization of unvaccinated people, who include our patients, colleagues, and other fellow citizens, noting the evidence that vaccinated individuals play a large role in transmission. American bioethicist author Kaplan responded to Kampf, writing criticizing the unvaccinated who wind up in hospitals and morgues in huge numbers, put stress on finite resources, and prolong the pandemic. Is not stigmatizing. It is deserving. It is deserved moral condemnation. So people became very uncultured, very stressed, very disorganized in their thinking and behavior, even people in high offices. Such was the impact resulting from the pandemic, COVID-19. In January 2022, Amnesty International urged Italy to change their anti-COVID-19 restriction to avoid discrimination against unvaccinated people, saying that the government must continue to ensure that the entire population can enjoy its fundamental rights. The restriction included mandatory vaccination over the age of 50, the mandatory vaccination to use public transport. Lifestyle changes. The Wee Ernie statue in Gorok, Scotland, was given a face mask during the pandemic. The pandemic triggered massive changes in behavior, from increased internet commerce to cultural changes in the workplace. Online retailers in the US posted $791.70 billion in sales in 2020, an increase of 32.4% from US dollar $598.02 billion the year before. Home delivery orders increased, while indoor restaurant dining shut down due to lockdown orders or low sales. Hackers, cybercriminals, and scammers took advantage of the changes to launch new online attacks. Education in some countries temporarily stifled from physical attendance to video conferencing. Massive layoffs shrank the airline, travel, hospitality, and other industries. Despite most corporations implementing measures to address COVID-19 in the workplace, a poll from Catalyst found that as many as 68% of employees around the world felt that these policies were only performative and not genuine. The pandemic led to a surge in remote work. According to a Gallup poll, only 4% of US employees were fully remote before the pandemic, compared to 43% in May 2020. Among white-collar workers, that shift was more pronounced, with 6% increasing to 65% in the same period. That trend continued in late stages of the pandemic, with many workers choosing to remain remote even after workplaces reopened. Many Nordic, European, and Asian companies increased their recruitment of international remote workers even as the pandemic waned, partially to save on labor costs. These also led to a latent drain in the global south and in remote areas in the global north. High cost of living and dense urban areas also lost office real estate's value to remote workers' exodus. By May 2023, due to increasing layoffs and concerns over productivity, some white-collar workplaces in the United States had reported to performance review penalties and indirect incentives, example, donation to charity, to encourage workers to return to the office. Historiography. A 2021 study noted that the COVID-19 pandemic had increased interest in epidemics and infectious diseases among both historians and the general public. Prior to the pandemic, these topics were usually overlooked by general history and only received attention in the history of medicine. Many comparisons were made between the COVID-19 and the 1990 and 1918 influenza pandemic, including the development of anti-mask movements, the widespread promotion of misinformation, and the impact of socioeconomic disparity. Religion and how these were impacted by the pandemic. An American Catholic military chaplain prepares for a live stream mass in an empty chapel at Offutt Air Force Base in March 2020. In some areas, religious groups exacerbated the spread of the virus through large gatherings and dissemination of misinformation. Some religious leaders decried what they saw as violation of religious freedom. In other cases, religious identity was a beneficial factor for health, increasing compliance with public health measures and protecting against the negative effects of isolation on mental well-being. Disinformation as a result of COVID-19, media coverage of the COVID-19 pandemic, impact of the COVID-19 pandemic on social media, and impact of the COVID-19 pandemic on journalism. Some news organizations removed their online paywalls for some or all of their pandemic-related articles and posts. Many scientific publishers provided pandemic-related journal articles to the public free of charge as part of the National Institutes of Health COVID-19 Public Health Emergency Initiative. According to one estimate from researchers at the University of Rome, 89% of COVID-19 related papers were open access compared to an average of 48.8% for the 10 most deadly human diseases. The share of papers published on preprint servers prior to peer review increased dramatically. Misinformation due to COVID-19 conspiracy theories about the pandemic were widespread. They traveled through mass media, social media, and text messaging. World Health Organization declared an infodemic of incorrect information, cognitive bias, such as information bias, were linked to conspiracy beliefs, including COVID-19 vaccine hesitancy. Transition to epidemic phase. Endemic COVID-19. In June 2020, an article in Human Genomics said that the pandemic was still raging, but that now is the time to explore the transition from the pandemic to endemic phase. The latter will require worldwide vigilance and cooperation, especially in emerging countries, and suggested that developed countries should assist in boosting vaccination rates worldwide. As of May 2023, health officials in some countries have said that COVID-19 is endemic, or that the country was beginning to transition to an endemic phase. These included Cambodia, Indonesia, Lebanon, Malaysia, Mexico, the Philippines, Singapore, South Korea, Spain, Vietnam, and Falkland Islands, and Croatia. On the 3rd of December 2022, World Health Organization Director General Tedros Adhanom Ghebreyesus stated, "We are much closer to being able to say that the emergency phase of the pandemic is over." On the 10th of April 2023, this year, US President Joe Biden signed a House bill ending the COVID-19 national emergency. The separate HHS-led public health emergency ended on the 11th of May. On the 5th of May 2023, the World Health Organization declared that the pandemic was no longer a public health emergency of international concern. Ghebreyesus stated that the pandemic's downward trend over the preceding year had allowed most countries to return to life as we knew it before COVID-19, though cautioning that new variants could still pose a threat, and that the conclusion of the current state of emergency did not mean that the COVID-19 pandemic is no longer a worldwide health concern. Conflicting, slightly confused messages coming from the authorities, including from political leaders. We're looking at culture and society. How COVID-19 pandemic are impacting on popular culture, the pop culture. COVID-19 pandemic has had a major impact on popular culture. It has been included in the narratives of ongoing pre-pandemic television series and become a central narrative in new ones with fixed results. Writing for the New York Times about the then upcoming DBC sitcom Pandemonium on the 16th of December 2022, David Segal asked, "Are we ready to laugh about COVID-19? Or rather, is there anything amusing or recognizable in a humorous way about life during a plague with all its indignities and setbacks, not to mention its rituals and rules?" The pandemic has driven some people to seek peaceful escapism in media, while others were drawn towards fictional pandemics, example zombie apocalypses as an alternative form of escapism. Common themes have included contagion, isolation, and loss of control. Many drew comparison to the fictional movie Contagion from 2011, praising the film's accuracies while noting some differences, such as the lack of an orderly vaccine rollout. As people turn to music to relieve emotions evoked by the pandemic, Spotify listenership showed that classical, ambient, and children's genre grew, while pop, country, and dance remain relatively stable. Thank you for watching up to now. This is record 2 hours and 20 minutes. Unprecedented, but worth its while. So we have done with COVID-19. We have looked at the processing of the problem in society, in countries across the globe. We've looked at how the behavior of society, of the people, of the authority, of the government impact these events created. And I made this video to help us look at the cost of living as being one of the factors, one of the crises we face. And that's why I've been talking about the cost of living since the beginning of this program. And going forward, I'll be carrying on with talking about the cost of living as a crisis, linking it to other factors, other crises such as COVID-19. And I'm so grateful for you staying late or early, depending where you are watching this video. And leave a comment below. Click a notification bell. Subscribe for new contents. If you like, if you don't like, something somewhere is of value to some people when activity occurs. Society is about activity. And this channel is about activity. It's about engagement. It's about taking time to participate, to see what is going on. Life is changing. We have social media. We don't know how long social media is going to last, but it is a media, nevertheless. It's trending. It's a phenomenon. It's something we can embrace as society, as communities, as families, as friends, or as strangers. At the beginning of this video, I'm pointed out at the flaws involving human beings calling each other strangers. Our behavior is reflective of a cultural defect, which actually it is the outcome of our failure to educate ourselves as human families to live peacefully